Hello, my name is Dr. Megan Gilmore and I'm one of the bariatric surgeons at Mayo Clinic Health System. We have locations in Mankato, La Crosse, and Eau Claire. The purpose of today's information session is to provide you with information about how weight can affect your health and some of the treatment options that are available, including the surgical options that can help improve your health and quality of life. After you complete the online session, you may contact the bariatric clinic nearest you. The phone numbers will be provided at the end of this video. We ask that you watch the entire video prior to calling our office. In the United States, about 2/3 of Americans are overweight and 40% of Americans suffer from obesity. This number has doubled in the last 20 years, and what is even more alarming is the rate of obesity has actually tripled in our adolescents. In medicine, we use numbers to classify weight just like we use numbers to classify diabetes or high blood pressure. The number that we use when we're talking about weight is called a BMI, and this is a way that we can classify your weight. This number is important because this is the number that insurance companies look at when they decide whether or not you can have bariatric surgery. Obesity is a complex disease that affects many different aspects of our health, such as our behaviors, our environment, and our genetics. These factors interact to cause weight gain or weight loss. We believe that since there are so many different factors that affect our weight, we need an individualized approach to treating obesity. That is why we use a multidisciplinary team to help our patients achieve their goals and be successful with weight loss. Our weight can affect our health in many different ways, and there is a known association between things like diabetes and heart disease. But many patients don't realize that our health affects many other aspects of our life. There is a link to things like liver disease, sleep apnea, and even certain types of cancer. Managing your weight will improve some of these health conditions for patients who are suffering from obesity. This slide demonstrates how much improvement you can see in various different medical problems. The most well-studied is diabetes. We see improvement or remission of diabetes in between 43 to 85% of patients. The degree of resolution of diabetes depends on how long you've had diabetes and whether or not you're using insulin. The bariatric team consists of surgeons, advanced practice providers, bariatricians, dietitians, behavioral health specialists, physical therapists, and exercise physiologists. Our dietitians provide one-on-one individualized sessions. They will help you to prepare for after surgery as well as help you make changes for diet that will be necessary to help maintain your weight long-term even after surgery. One of the key elements of maintaining weight loss is exercise. Our physical therapists and exercise physiologists will help you develop an exercise program that you can start prior to surgery. They will also teach you how you can advance your exercise program as you become more fit and lose weight. Returning to that BMI number that I talked about earlier, most insurance companies will not pay for bariatric surgery unless your BMI is over 35. If your BMI is between 35 and 40, you do have to have a comorbidity such as diabetes or high blood pressure. If your BMI is over 40, then you qualify for bariatric surgery based on your weight alone. Once you complete this video, you will contact our office so that you can start seeing our team. You will have visits with the dietitians, psychologists, and exercise specialists. Once the entire team feels that you are ready to proceed with surgery, you will meet with the surgeon to talk about the surgeries and discuss the risks and benefits of surgery. In addition to having appointments with our core team, you may have additional visits with certain specialists such as sleep medicine. We will work with your primary care provider to make sure that all of your medical problems are well controlled prior to surgery. Your diabetes must be under good control and your sleep apnea should be treated prior to surgery. Additionally, if you smoke or use nicotine products, you will need to stop prior to surgery. It is important that you are committed to not starting smoking again after surgery. Because of changes in your anatomy, if you continue to use nicotine or tobacco products, you would be at increased risk of having serious complications such as ulcers. We offer two procedures, the gastric bypass and the sleeve gastrectomy. Here is a depiction of the gastric bypass. The gastric bypass is one of the oldest bariatric surgeries and does provide the most weight loss and resolution of other health problems. Here is a depiction of the sleeve gastrectomy. The sleeve gastrectomy is very similar in regards to the gastric bypass when we talk about weight loss and resolution of comorbidities.
In Roux-en-Y gastric bypass, the surgeon creates a small pouch at the top of the stomach. The pouch is the only part of the stomach that receives food. This greatly limits the amount that you can comfortably eat and drink at one time. The small intestine is then cut a short distance below the main stomach and connected to the new pouch. Food flows directly from the pouch into this part of the intestine. The main part of the stomach, however, continues to make digestive juices. The portion of the intestine still attached to the main stomach is reattached farther down. This allows the digestive juices to flow to the small intestine. Because food now bypasses a portion of the small intestine, fewer nutrients and calories are absorbed. In a sleeve gastrectomy, part of the stomach is separated and removed from the body. The remaining section of the stomach is formed into a tube-like structure. This smaller stomach cannot hold as much food. It also produces less of the appetite-regulating hormone ghrelin, which may lessen your desire to eat. However, sleeve gastrectomy does not affect the absorption of calories and nutrients in the intestines.
Pregnancy should be avoided for 12 to 18 months following surgery. All female patients of childbearing age should be on reliable birth control prior to surgery. Periods of rapid weight loss can be difficult during pregnancy, as it can be hard to provide the nutrition that the baby needs. Once your weight loss has plateaued, pregnancy is safe. All psychiatric problems should be stable for 1 year prior to surgery. This means that you should have had no suicide attempts or psychiatric hospitalizations. Patients often ask if there are reasons they cannot have surgery. If your health condition is severe enough that you are not able to undergo anesthesia, then we cannot provide the surgery. If you have a condition called Barrett's esophagus, you would not qualify for sleeve gastrectomy. As with any surgery, there are risks associated with bariatric surgery. These risks include general risks such as risk from anesthesia, bleeding, infection, and injury to surrounding structures. There are, however, some risks that are specific to bariatric surgery. Complications such as leaks, strictures, dumping syndrome, and heartburn are all conditions that you will discuss with your surgeon prior to surgery. All of our surgeries are performed minimally invasive using 5 to 6 small incisions. You will be in the hospital for 1 night after surgery, and you will go home on a liquid diet with protein shakes. Your diet will be advanced over the next couple months under the supervision of your dietitian. We recommend taking 2 to 3 weeks off of work after surgery. You may feel physically ready to go back sooner. However, there are many different dietary changes that you have to become accustomed to before going back. One of the most common reasons for readmission to the hospital is dehydration. It does take some time to learn how to get all your fluids in during the first few months after surgery. Weight loss expectations will be discussed with you at your initial appointment. However, we can provide some generalizations. Patients who have a gastric bypass can expect to lose about 70% of their excess body weight. Patients who have a sleeve gastrectomy can expect to lose about 60% of their excess body weight. For a woman who is 5'6" and weighs 280 pounds, she would have a BMI of 45.2. If she had a gastric bypass, she would lose about 70% of her excess body weight. This would give her a goal weight of 175 pounds. If she had a sleeve gastrectomy, we would expect her to lose about 60% of her excess body weight, giving her a goal weight of 190 pounds. For a man who is 6 feet tall and weighs 300 pounds, he would have a BMI of 40.7. Based on this weight, he has 129 pounds of excess body weight. We would expect him to lose 70% of that weight. This would give him a goal weight of 210 pounds after a gastric bypass. If he had a sleeve gastrectomy, we would expect him to end up around 222 pounds. We also have support groups for patients who have had weight loss surgery or are considering weight loss surgery in the future. After you complete this video, please contact our office at the numbers listed. We will need to get your insurance information so we can check with your insurance company if you have coverage for bariatric surgery. Once we get your insurance information, we will check with your insurance company to make sure that you have coverage for bariatric surgery. We recommend that you also call your insurance company and make sure that they are telling you the same thing they are telling us, as sometimes there can be miscommunication between insurance companies and our programs. Once we find out if you have bariatric coverage, we will call you to make an initial appointment with our bariatric team. Thank you for listening to this information session, and we look forward to working with you as you embark on this journey towards a healthier lifestyle.